This is Sandy Tankis for TOS50.com, the other side of 50. And I'm here once again with Dr. Donna Geffner, Director of Graduate Programs, Speech Language Pathology and Audiology, and Speech and Hearing Center at St. John's University in Queens. Good afternoon.
Good afternoon. Good to see you again.
It's good to see you again, too. You've spoken to us in the past about hearing loss and about hearing aids, and I'm wondering if you can tell us what some other health risks might be once we're on the other side of 50.
Okay. Well, to begin with, there's always the problem with vascular circulation, cardiac problems, people who unfortunately are overweight, that have weight issues that put more pressure on their cardiovascular systems. And one of the things that is always of fear is the stroke in patients, because stroke is the leading cause of death in the United States. And as one gets older, the arteries get a little more clogged, and there's always the opportunity for hemorrhagic strokes or occlusions to occur, just as it could affect other patients like cancers. And as one ages, there's greater propensity towards lymphomas in older people, and of course disease processes and neuromuscular problems. As one develops more arthritis, too, that becomes a problem in movement and mobility, basically. But stroke is a really concerning problem in our population as one gets older.
Yeah, I know it is. And so what are the signs of having a stroke?
Well, for one thing, you have to be very careful, because it's usually one side becomes more drooping and even numbing, or some tingling that can take place on the side. Usually it's the right side of the face, and the right arm gets a little more numb, and the person starts to walk more slowly, and speech gets slurred. And in fact, Sandy, you know, there's a very good little test that people need to know about. And the first is to smile, so you look for symmetry in the face. Raise your right arm to see that you could really make the movement. And the third one is to say a sentence to see if there's speech slurring. Unfortunately, if it does result into what sounds like a stroke, you need to get medical attention ASAP, immediately. No questions about it. You call 911. We do have something also called TIAs, transient ischemic attacks, and those are like early warning signs. And I want to urge people out there not to neglect those signs. Those signs are early warning signs, and we can often do something more preventative about it, like check out the circulatory system and look for any occlusions in arteries and in the body. But the TIA is where somebody might have a period where they're blacking out, they lose consciousness very quickly, their speech is slurred for that brief moment, and sometimes a person may just slough it off and say, well, no, it's an incident. But it's really something you must be very, very aware of and not let it go. Get medical attention.
So what should somebody do if
they need to get medical attention and have a very good physical workup and do a stress test and look at their cardiovascular system and test out their arterial flow and their blood flow to make sure there is no occlusion. Because once you block the air and the blood and the oxygen to the brain, you suffer brain loss. And one of the consequences to stroke is often, you know, the brain damage and the loss of language and aphasia. Aphasia is a language condition that results from stroke, and that means that the person has difficulty expressing himself or understanding, and they may have trouble with their oral motor skills and speaking. That's something that we see at our center very frequently, in addition to some of the paralytic conditions that they suffer from. And stroke has no sympathy for the highest level of educated people to the lowest level. It affects everybody in very similar ways, or some people get away and they do make a very good spontaneous recovery.
Well, gee, thank you so much for speaking to us again. And once again, your information is on the website if people want to get in touch with you. And good afternoon.
Thank you.